All right. So my name is Eli Griffin. I am a procurement coordinator here at KCRHA, and I use any gender pronouns. I am the lead coordinator for this letter of intent process. And I'm going to pass it to my colleagues here at KCRHA, Jeff and Nicole.
I'll go next. My name is Jeff Sims. I use he, him pronouns. I'm the Senior Director for Policy at KCRHA, and I've been very intricately involved in a lot of the overall initiative at KCRHA related to state-owned rights-of-way and the money that the state is giving us to, resolve those encampments through strong connections to housing. Nicole?
Morning, my name is Nicole Scott. Go by she, her pronouns. I oversee the emergency services department here at KCRHA. And I'm not going to be on camera much because I'm not feeling well. I just wanted to make sure I listened in and see what's going on with this project.
Thank you so much for joining, Nicole. I hope you feel better soon.
Thank you.
All right. So for today, we are going to review the timeline of the LOI process, get some background on the right-of-way initiative, discuss the purpose of the process, go over program highlights, funding and budget, rating and scoring, application details, a review of flux, and then go into Q&A. So for this letter of intent process, the LOI was released on December 18th, and we are doing the information today, December 22nd. And the last day to submit questions for this process is December 29th at 5 p.m. The deadline for the application is January 8th at 11:59 p.m. If a virtual tour or interview is needed, those will be on January 18th and 19th. The denial and award notifications will be on January 24th. Appeals will be due January 31st. Contract development will be through January 24th through 31st. And then the estimated contract start date is February 1st. And with that, I'm going to hand it over to Jeff to get some background on the right-of-way initiative.
Thanks, Eli. So some of you on the call, I think, are already familiar with this. It's in 2022, the Department of Commerce at the request of the governor developed an initiative to respond to encampments that are on state-owned rights-of-way, usually WSDOT property. And in King County, almost all of the, in fact, I think all of the locations have been on WSDOT property alongside or really close to I-5. KCRHA's award in the first year was $49.2 million. That the limit in the approach is that we have to only be serving individuals that are responding to individuals that are on encampments on state-owned property. However, with the amount of funding that was available, things like that, and the tremendous need we have, we were willing to engage in even that kind of a limited approach because we want to make sure that we were bringing every resource we could to the county. That award, 19 million of it was to acquire a new construction building that Lehigh it was actually the purchaser of and will be opening, we believe, in mid-January. Then we also had a $12 million of that has gone to emergency housing, which has been a large part of our ability to respond quickly to locations. That's been hotel sheltering. And then the last piece has been master leasing, or has been permanent housing units. Almost all of them have been master leased units, either in small clusters in various market rate units or market rate buildings that the landlord has allowed us to lease the entire building and put people into that. And then, of course, we're paying service providers that are providing the housing stabilization and behavioral health services to go with it. So that was the first year of money. A lot of those initial investments drop down and you only have, and there's a $16 million, almost $17 million ongoing amount of funding given to King County that maintains all of that permanent housing, those permanent housing placements. And so that's, what we'll see is the emergency housing and our field outreach teams will gradually decrease, and then we will just maintain the permanent housing that has been developed. This has been very successful so far. We have approximately 90% of the individuals that we've encountered have moved indoors to a shelter, and then many of them onto permanent housing as well. So there's been 320 people have moved inside from 10 different encampments. And then I wanted to flag that this funding in particular that this LOI is related to some additional one-time funding that the Department of Commerce is giving us. They shared with us that we would receive the award just a couple weeks ago. This is an allocation of just one-time funding. So you can see the dates here, services. Oops, I think. Oh yeah, July 23. That was the funding was appropriated for July 23 to June 2025, but we didn't learn that we'd be receiving the funds until December. So we're anticipating that the services obviously won't have started 4 and 5 months ago. They'll be starting on January 1. The total amount though, over those 18 months that we actually can be doing services is $27.5 million. And a portion of that is what is being competed here. It's $500,000 from January 1 until June 30th, or well, not quite January 1, but beginning of the year to June 30th. And then another $1 million to continue those same enhancements that this LOI is seeking for another 12 months after that. So it's about an 18-month total amount of time that the scope of this this funding will be available to whatever applicant is ultimately awarded the funds. And I think that that's the end for me. Eli, do you want me to take questions now if there are any, or do you want me to keep plowing through?
We will keep on going through. Thank you so
Okay.
much, Jeff.
Sure.
All right. The purpose of this letter of intent is to identify an agency to provide enhanced shelter services as part of the right-of-way initiative that Jeff just talked about. And so this is enhancing services and supports offered at existing shelters, existing shelter locations that serve single adults to ensure that the shelter program can provide low barrier shelter services regardless of the acuity of the client's needs, and is adding supports and services enhancements to an estimated 40 total beds at existing shelter programs for individuals who otherwise would not move out of encampments targeted for resolution or that require care and supports that typically preclude their enrollment at a shelter. So I want to highlight that this is 40 total beds. It can be across several agencies. So it could be one agency does 40 beds, or it can be multiple agencies applying for smaller amounts. The scope of this program includes it being rooted in well-being, person-centered, harm reduction, and trauma-informed practices. Shelter units need to not be currently set aside for use by another program. They need to be currently vacant or expected to become vacant early in the award period. And additionally, it's to provide shelter services to individuals referred by KCRHA through the state right-of-way initiative and ensure there would not be denials or turnaways due to an individual's need exceeding program capacity. And that includes offering the following services and supports. I apologize for the small print on this screen, but these supports include dedicated clinical behavioral health specialists on site, residents having direct access to mental health resources, either through on-site staff or designated connections at an associated provider. Staff are trained well and versed in conflict resolution and de-escalation techniques with a working knowledge of mental health disorders. Access to medicated assisted treatments, either directly or through service connection, including methadone, buprenorphine, and naloxone. Overdose prevention, safe injection, and harm reduction supplies on site, including Narcan and fentanyl test strips. Connections to healthcare providers to support physical healthcare needs, such as wound care and medication management. Pet-friendly units accommodating support and companion animals, on-site property storage with secure and controlled access to shelter 24 hours a day, 7 days a week, community room on site for clients to access 24/7, on-site designated space for case managers and other service providers to meet confidentially with clients, site security that includes review of the areas and sidewalks around the program and related good neighbor practices, and then case management staff to support housing navigation and planning. And these are either currently being provided or once funding for service enhancements is provided. And this is really about creating a foundation for individuals who really need these support services to be brought inside to a shelter. The program needs to be centered in KCRH's theory of change. If we create a homeless response system that centers people with lived experience, then we will be able to meet needs and eliminate inequities in order to end homelessness for all, include people with lived expertise for homelessness and disability in policy and program development, and advance equity for Black, Indigenous, and other people of color, as well as people who identify as LGBTQIA Two-Spirit Plus, and individuals with disabilities. So all proposals will be reviewed to ensure completeness, alignment with the program scope that we just reviewed, and budget feasibility. And then the rating team will recommend proposals to be funded, giving preferences to proposals that meet the scope that we just discussed. For program eligibility, as this is enhancing beds that are currently in ongoing shelter programs. This must be entities that are currently overseeing a current shelter program, and those eligible organizations and programs are listed in the letter of intent. Grantees are responsible for maintaining clear and accurate project records. And again, any staff with regular interaction with residents must have de-escalation training and other support to provide trauma-informed harm reduction, well-being, and person-centered care. Eligible costs for this are comprehensive program operations, including but not limited to intake and de-escalation, maintaining the safety and security of residents and their belongings, maintenance of hygiene and maintenance, and so on. And ineligible costs are acquisition, rehabilitation, or new construction of a building. Performance commitments will be determined during contract negotiation, but agencies will report on client outcomes to ensure we are meeting the goal of this program. And examples of what those performance commitments can be include number of individuals enrolled in row-specific shelter beds and units, number and percent of client enrollments in row-specific shelter beds and units that end in an exit to permanent housing, and length of stay of clients in row resolution-specific sheltered beds and units. Again, these are just examples. The funding was discussed a little bit earlier, but just to go in a little bit more depth. So this is as part of the ROW initiative. 500,000 will be for February 1st through June 30th, 2024, and then 1 million for July 1st, 2024 through June 30th, 2025. And it's really important to know that the funding source and the connected services will end on June 30th, 2025, unless alternative options are identified by the contractor to continue enhanced shelter services after June 30th, 2025. So this award, as I mentioned, may offer up to 1.5 million, and we expect to award at least one agency. And as I said, the expectation for this award is for the funding to go away after June 30th, 2025. For the rating and scoring, applications will be rated out of 100 points for agency experience, which is possible up to 20 points, staffing and service proposal, 40 points, racial equity and social justice, 20 points, data and fiscal management practices, 5 points, and then budget for 15 points. The virtual tour and interview might possibly happen. If they do, they may supplement lost points in one or more of the categories above, but they are not rated as a standalone category. The full applicant pool will be rated by a rating team composed of community members, subject matter experts, and individuals with lived expertise. And that team will recommend applications to be funded and implemented the week of January 15th with estimated contract start date of February 1st. The application is due January 8th. That is actually Tuesday, January 8th by 11:59. Oh, that is a Monday. I apologize. All applications must be submitted through Flux. And if you or your organization are new to Flux, you must set up an account. And it's highly recommended you start your application early and retain a copy of your responses on a Word document. The Flux application open date will be December 29th, 2023. You may see one open on Flux currently, but that is not an up-to-date application. Just a little more details for Flux for folks who are new to it. It is our grants and contracts management system to simplify contracting, invoice reporting, and RFP process for service providers. And in order to access the KCRJ Flex website, there is a specific KCRJ grants link that can also be found on our funding opportunities webpage. KCRJ staff will be reviewing and approving accounts within 48 hours. Once you receive an email with your username and a link to reset your password, do that as soon as possible. Then once you are able to access your account, go to people and then organization to ensure all information is accurate. And if organizations that have used Flux before can also do that as well, it is extremely helpful for us to ensure we have the correct contact information for you. Then, of course, navigate to apply for funding and begin to complete the letter of intent application associated with this project, which will be the titled the 2024 Row Shelter Enhancement Letter of Intent. Complete it in its entirety, review the form for accuracy, and then submit it for review. For more information, you can go to our funding opportunities webpage, which is where we have our live funding opportunities posted, our any notice of funding availabilities, RFPs and letter of intents are posted there, as well as our recorded information sessions, including this one, which will be posted next week. Any questions and answers specific to this letter of intent will also be posted there as well. If you have any questions, you can always email rfp@kcrha.org. All right, and with that, we will go to the question session of this, and I will stop sharing my screen.
Eli, can I chime in on one thing that I realized looking at our attendees should know?
Yep, absolutely.
I see that we have a few different youth serving organizations here, and this LOI is intended for single adults. So I want to make sure that was clear. The vast majority of the individuals were required by the funding to serve people that are on state-owned rights of way, and the vast majority of the individuals that are in those specific encampments are single adults, and that's why it's narrowed to that group. So I want to make sure that you are aware of that as you're considering your application.
Thank you, Jeff. I see a couple of questions in the Q&A, and then I see John. Let's go ahead and start with you with your hand up.
Thank you. I just want to make sure I heard a couple of things correctly. You're looking to just to make a single award to a single organization or to multiple organizations?
We expect at minimum to award one agency, but it is open to multiple agencies.
Great. And then my follow-up question is, we were trying to figure out if we have a number of tiny house villages in Seattle that, serve this population. There's certainly an overlap between our high acuity sites and the types of folks that would be referred from the rights of way. the Hope team, makes referrals to the program. And so I'm just wondering how the Hope team referral system works with our shelter programs that are listed in the RFP as eligible, and how that would work with the right-of-way referrals. Like, would they be routed through the Hope team, or just trying to figure that out?
Give me an answer that, Eli. Okay. John, thanks for asking that question. That's very important, actually. So if you are looking at the LOI document itself, you'll note that it says that it's only for beds that are not currently set aside for other programs, and specifically lists out the UCT. So any bed that the UCT currently has the referral control over wouldn't be eligible here, because we would have to have, there wouldn't be overlap between the two. The UCT is not working on the right-of-way encampments. So it'd have to be beds that are not currently set aside for them.
Okay, thank you.
All right. Thank you, Jeff. And then I have a couple of questions in the Q&A. And so the first one is, can you please provide certificate of debarment and suspension form? We have a template for that. So if you can email, I only see it as an anonymous participant. So if you need the template for that, please email rfp@kcrha.org. And we will be able to provide that template for you. Next is the question about the availability for a 45-minute virtual site visit is absent in flux. Is that intentional or an accident? The current flux application is a draft. So don't start using the flux application until December 29th, as we still have a couple of questions to add to it. And then, can funding be used to support temporary operations such as for severe weather? And I think Jeff's answer earlier applies to this, that it is, sorry, Jeff, your phrasing was perfect. Can you repeat that?
Sure. Yeah, the funding requires that we would serve individuals that are located on state-owned rights of way, and it actually extends for the full 18 months. So it wouldn't be limited to severe weather events, and it would only be individuals coming from those locations that could be referred in. And so that's a funding requirement for us. So we aren't able to negotiate on that. So severe weather wouldn't really be an eligible use here, especially like, usually we think of a severe weather activation as being time limited, whereas this is intended to be an 18-month period that these beds are active for, or I should say enhanced for.
Great, thank you, Jeff. Any other questions?
I have a quick question. Since the Flex page is going to open on the 29th and the last day of question and answer is also on the 29th, I was wondering if it would be possible to extend the question and answer period to like January 3rd or something like that.
The Flex application will be identical to what's in the letter of intent. So the questions that you see there will be the same. So if you have any questions about what's in the application, it will be the same. If you have any questions about Flux, not about the LOI, we can answer those if you're having difficulty, with a technical part of Flux that's not related to the LOI. We're able to support that.
Okay. Also, I was thinking because of the holidays too, we might, a little extension might be helpful too, to make sure we get input from all the staff and be able to ask questions in time. So is that date flexible to move forward, or?
I would have to look into our policies on that. So when the FAQ is posted, there will be an answer. But I just have to review our policies to see if that's a possibility. I believe it's not possible, but I will double check. Yeah.
Thank you for checking.
Yep. Yeah, I understand this is a really hard time of year to be filling out an application, but we tried to give folks as much time as possible, especially since this funding starts January 1st. We wanted to give providers as much time to spend that money as possible. So I understand, and also I'm very appreciative for all of you joining today on a holiday weekend as well.
Cool. Yeah. Well,
Yep.
thank you. Yeah, it was very informational. Thank you.
If I could add to that, Eli, because the first third of the funding expires on June 30th, which we don't have flexibility around, that was the other reason that we obviously wouldn't want to make sure we're getting the awards out as quickly as possible.
Yeah. 5 months to spend 500,000 is not quite a lot. All right, John, I see your hand is up.
Thanks again. I'm trying to wrap my head around how the UCT referrals could work for our program. Since they have more or less exclusive the ability to refer into our tiny house programs. So is there a scenario where, I mean, could we, I know this is maybe a question to them and not to you, but is there a scenario where they get right-of-way referrals and then UCT places them into our program? Because otherwise, like 90% of our shelters are kind of de facto not actually eligible for this grant. Do you see what I'm saying?
Oh, Jeff, you are on mute.
Thank you, Eli. Yeah, John, I definitely understand that. And certainly, like, tiny homes could be a great match here. The challenge, I guess we could be open to a conversation if it really would be with you and the UCT, because this operates very independently of the UCT. We are being cautious not to intrude upon the resources they utilize. And I don't imagine that there's a pathway by which they would allow some portion of the beds currently set aside for the UCT to be taken away from that availability and only available for a right-of-way referral. We would not be proposing to do something like that, which is why the letter of intent is phrased as it is. So hopefully I'm not perfectly familiar with the portions of Lehigh's portfolio that are not set aside for the UCT. I don't know if there's single adult beds are in that, but perhaps those could work.
Yeah, it's the ones that aren't are largely family shelters, like our, Progressive Skyway Village, for example. So it's not the ones that aren't set aside for UCT are not going to be eligible for different reasons, largely because they're the family sites.
Then it sounds like there might not be perfect compatibility here. I mean, I think that you and I are seeing the same thing, and that's unfortunate. But if there's a pathway that you unearth, or a willingness to work around that, but from our perspective, the key is just that we can't have another program that has the referral rights when the funding we're utilizing requires that it's serving certain individuals that we're referring, so that they'd be incompatible at that point.
Thank you.
All right, any other questions? I am not seeing anything in the chat or Q&A. So if you have any other questions, feel free to reach out to rfp@kcrha.org. And I just put that email address in the chat. We are able to answer questions through the 29th on this. And then the FAQ and the recorded info session will be posted next week. I also, again, want to thank you all for joining on a Friday right before a major holiday weekend. I really appreciate that and your time. So with that, we will call it, and thank you all so much.